Hey there, thanks for joining me live on this lovely Wednesday afternoon. My name is Julie Hirschberg, the owner, founder of Re+active Physical Therapy and Wellness in the Los Angeles area, and joining you as I have done every week for a while to share what we have been doing, what we've been learning, and as is the case with many other weeks, we're talking about functional movement disorders. And particularly, I want to share with you a really cool article. I see Brennan join me. Hey, Brennan. I want to show you this particular article. So I'm going to bring it up here in the background. So give me a second. This article here. So this article is from Brain, just published in June of 2021, called Misdirected Attentional Focus in Functional Tremor. And I spent a little bit of time reading this weekend, and I kind of love reading. And there were so many great things in this article, I just had to share them with you. So I want to go through a few of the pieces to set you up here. So first of all, functional tremor. What is that? It's a type of functional movement disorder where the person experiences a variable type of tremor. So it's not there all the time. It comes and goes, and it can be in different parts of the body and move around. So it's a type of functional movement disorder. It's something that we see a lot. And what this study aimed to look at is what particularly is it about attention and focus of attention that might drive the abnormal movement pattern. Now, you probably have heard me a lot talk about how we use the external focus of attention to remediate or recover from this. And that's what I love about this article. It gets down to the underlying reason why that helps somebody. So I'm gonna take, can I get rid of this here? Yes. So I'm gonna take that out of the way for a second. I just wanted to show you the article. So it's from Brain. The first author is, I think maybe Huys is how you say that, from the wonderful group in the UK. They put out a lot in functional movement disorders. So let me set you up for this article. So again, the functional movement disorders and functional neurologic disorders are the second most common diagnoses to present to a neurology clinic. This is why I hop on here every week to chat about this, because it's so common yet so misunderstood. A lot of people have to go to multiple doctors and neurologists before they even get a diagnosis. So we're here to change that. So they start off with talking about how common it is, how common tremor is as part of the disorder. And the intriguing part about functional tremor is that when the attention or the attentional focus is changed, the tremor changes, and the tremor may go away completely and automatic movement emerges. This is exactly what we do in rehab, and this is what they were looking to understand. So they didn't want to just look only at attention, but actually what is the focus of the attention? So proprioceptive information, visual information. So they really created this brilliant design to be able to test this out. So here's what they did. Another brilliant thing they did, they had three groups. They had people with tremor, so dystonic tremor, essential tremor, Wilson's disease. They had people with functional tremor, diagnosed functional tremor, and then they had people who didn't have tremor. So they had three groups so that they could really compare them. And so then they did this really brilliant task. And I actually had to read through the article a few times to really understand what they did. And it's brilliant. So basically it was like a computerized task. They had a touchpad with a target, and they had the person's arm hidden from view, but the cursor that they could see on the screen mapped their trajectory. So they were getting feedback about their movement. The goal was to reach a particular target. So, by the way, I have like all my notes here. I don't want to get this wrong for you all. So what was nice is the arm was hidden. They could change whether the cursor was present, so whether that person was actually getting feedback. Another thing that they did is they had the cursor change how bright it was. And they had the person tell them when they had the participant tell them when they noticed those changes. This is so brilliant because it would tell them then when, how attentive, how much focus the person is attending to their movement. So it's actually getting at how much attentional focus there is. I love these things. I know this is not what we would do in the clinic with this kind of computerized setup, but I think it really nicely, some of these motor control, motor learning research studies that are set up like this, they really get down to the underlying cause. So they did this. They did a series of tasks. They did a baseline task where they could see the cursor and they would go to their target. They did it with visual feedback. Where they could actually see their arm. They did it for accuracy, so the goal was to be as accurate as possible. So again, these are all people with tremor in their arms. They did it fast, they did it slow, and then this is a really lovely part. They did it in 2 different ways, focused on an external goal. So the first was that they would get to the starting position before doing another task. So it took out the actual like pointing task and said, this is just the starting position, and then we're going to do another task. So it took the focus off of that particular movement with the arm. And the second is they did the task and then they said, okay, now you're going to listen for a tone and I want you to tell me the time difference before the tone starts. And so again, the focus moved away from the task itself to measuring this tone. So you get where they're going here, right? Huge external focus, putting the movement within an external goal. This is the kind of stuff that we would take into treatment all of the time. So what were their results, right? So first, so interesting, confirms a lot. In functional tremor, they noticed that those people were high attention, focused on the movement. So they could notice if the cursor changed very, very rapidly, much more so than people with other tremors or people without tremors, significantly higher attuned to the movement. And we see that, but this really proves it, shows it. The person with a functional tremor was also worse when they watched the movement and got the feedback versus getting no visual feedback. So the visual feedback made it worse. This gives us a clue as to what we want to incorporate into treatment, right? Also, when the person had an attention to a goal, so either another movement or listening to the sound, movement was better. Their trajectory was better. There was less tremor. All of the people were worse with slow movement. So the people without tremor, the people with other tremor, and people with functional tremor, all worse with slow, all better with fast. So that's also interesting. I think tells you something about how our movement control is better in many instances when we're faster. So what does this all mean? It confirms to us that it is the attention, it's the focus of attention, particularly on the movement, that is an important piece of the puzzle in a functional neurologic disorder, particularly in functional tremor. That attention interfered and worsened their automatic movement. Now, they go on to long discussion in the paper, by the way, and they go on to say, we know this for a lot of normal movement. So things like recently, right, like Simone Biles and the twisties, right, or the yips in golf. This is known a lot in the sports motor control literature that if we attend to our body and our movements versus the goal, we can actually get kind of stuck and it can worsen our movement quality. So very similar premise here in the functional neurologic disorder. And then they go on to hypothesize that perhaps is it that there was an injury. So let's say you hurt your knee, right? So you have a physical injury. You're in a lot of pain perhaps, and you actually attend to the injury quite a bit, right? And we know this because this is part of, for some people, their natural history of their functional neurologic disorder is it's a natural to attend to an injury and attend to your symptoms. And over time, that attention can actually go awry and you start losing the automatic movement and your attention degrades your movement quality. That's what they certainly found true in this study of functional tremor. So they hypothesized perhaps this is part of the underlying pathology is that it's actually an attentional problem. Not that the person has an attention disorder, but that this abnormal self-directed attention starts to degrade their movement and cause a movement problem. Now we do know, and I'm going to just share this because I posted this today, we do know that we can take this attentional focus right into treatment. And this is exactly what they recommended as well. This is what we do as part of therapy. It's a huge part of the optimal theory of motor learning is to bring an external focus to our movements when we're learning and training things. So I put this together as 3 simple things based on this particular study. So number 1, stop the internal focus. So stop the cues such as how does that feel? Or do you notice your glutes firing? And maybe that's something I've thought of a lot working with my amazing colleague, Chris Powers, who studies this immensely. So that would be the first piece, is to stop the internal focus, maybe even the visual focus. That leads us to number 2, variability. So introducing some more variability into our motor learning. So can that movement be done faster? We know that worked for all people in this study to improve their movement quality. Can it be done without vision? So what this study showed us is that visual attention to the tremor worsened the tremor. So can we do it with eyes closed, and does that change things? And then of course there's many different ways we can obscure vision to introduce some variability. And then number 3, obviously, is to use the external focus. So in this study, again, when they used a goal beyond the movement, maybe even totally separate, like the sound goal or the reaching to the floor goal, the movement, the automatic movement, it like unmasked it. That's what I think of with an external focus. The automatic movement is there and the external focus unmasks that capability. It's so beautiful. So using that goal-directed movement can really help unmask what is possible for a person. Now, people say, well, then do I just have to have that random goal every single time? No, that is not the case. You don't have to step over a line or a block every time or kick a ball every time. As you practice and relearn that automaticity and decrease, basically move your attention away from the body and the movement itself into a goal, luckily, your brain starts relearning. This is what's so beautiful about neuroplasticity. It relearns it and then it sticks. You don't have that attentional focus on the body and movement. It starts to go away. Now, for some people, that's really rapid. For other people, it takes a little bit longer time. But that's what therapy is about, is actually building those opportunities to unmask that automatic movement and allow the person to relearn and, again, enjoy their automatic movement capabilities. So I love this paper. Highly recommend it. And again, I'll just post it up here again for you to see. This was the brain article. Sorry, it's taking a moment to come up here. Just from June 2021, so hot off the press, Misdirected, Attentional Focus, and Functional Tremor. Highly recommend it for all you healthcare providers out there. Like Sherry, I see you. I did put a link to this in our newsletter that's coming out on Friday. So if you are part of our newsletter, I'll send out the link. I'll send out the videos as well, so that you have those. I'm going to chat about another article that just knocked my socks off this week, where the kids in the study, actually 100% of them got better. And it's really fascinating. I'm going to talk about that on Friday in our Facebook Live. So 2 great studies recently hot off the press that I am sharing this week, and I'll put those in our newsletter. If you're not on our newsletter, you can definitely join it. Just go to reactiveeducation.com/newsletter and join our newsletter. And again, I am doing a free webinar on functional movement disorders. So if this stuff is kind of like, wow, this is really interesting. I love the brain and the complexity of it, but I really don't know what to do with this disorder. You should come to this free webinar. It's for healthcare professionals, PT, OT, speech, physicians, DOs, psychologists. We're going to do FMD made very simple. And I've been working on this webinar. I'm super excited about the framework we have to really simplify how we can approach and help people recover. So that's a free webinar. There's a link in our bio for that, but it's also reactiveeducation.com/FMD webinar. So that's coming up September 18th at 9 a.m. Pacific time, but you can catch the recording of it as well. It's probably something I have been the most excited about this year, to be honest. So, Sandy, hey, I see you joining us. Nice to see you. So thank you again for joining me today. I hope you'll join us for that free webinar on September 18th. And please share this. Share this with your colleagues. Share this with your friends. Share this with people that have never heard of functional movement disorders. We are on a mission to, hey, Sandy, to get the word out. Get the word out to people so that people are not searching through 10 different providers to find someone that understands this disorder. We're going to stop that, and we're going to help get people educated. So please share this. Please share the free webinar. And thank you so much for joining me today. I'll see you on Friday.